Hi, my name is Traci Christenson, and I work in the Department of Nursing. I'm here today at the Mayo Nurses Poster Fair, and as you can tell with the sound in the background, it's an exciting place. So come with me and let's check it out. Hi, I'm here with Lauren Meyer. Lauren, I see you have a great poster today at Poster Fair. Tell me about it.
We're really excited to share a poster about unit coaches. It's really taking off after the orientee is done with orientation. It's a resource guide to help branch them into feeling comfortable in their new role.
So how is this helping Mayo Clinic?
I think since orientation is new for a lot of Mayo Clinic units, this is just a continuation afterwards. It's very helpful to have the extra resources available.
What's been the most fun so far for you?
Everyone has tons of questions, and since this is new for everyone, they are really excited to learn how it's been going.
I'm here at the Priority Paging Guidelines poster. I'm here with Chris. Chris, tell us about your poster.
This is actually a project that started with a concern brought forth from the nursing staff, and it is in regards to the timeliness of response when we're contacting our providers. So we got a multidisciplinary group together and worked on a project to come up with some guidelines to provide clarity around paging, the primary service. And what's been really exciting about this project is that the more we talk to people about what we've done, is the more people we find out are having similar problems and are wondering why we didn't do something sooner.
Awesome. So how do you think this is affecting the overall patient experience?
I think that in a couple of ways. I think for one thing, it's really improved the communication and the timeliness of communication between the nurses at the bedside and the providers, who are really key to patient safety. I think that improved communication really does equate to improved patient care, safer quality patient care, and efficiencies.
That's really great. Well, thanks for sharing with us today, Chris. Stacy, I see you have a great poster at Poster Fair. Can you tell me a little bit about it?
I can. I'm one of the nurses from Gonda 12 ENT, and we are a pediatric practice that our poster is on post-tonsil phone calls. It's a quality initiative to improve access to the pediatric practice. So what we have been doing for tonsillectomy phone calls, we give the parents a call 2 to 3 days after surgery, make sure that they're doing okay, and then at that phone call, we go ahead and ask them if they would like to keep their 4 to 6 week scheduled visit. And a lot of times if they're doing fine at that, we'll go ahead and just transfer that appointment into a phone call. So both parents, the physicians, everyone is happy, and it's a cost saving and time saving for the patients.
That's really amazing. So what do you think has been the best comment you've received from patients so far about this?
The best thing is that the parents don't have to take off work, they don't have to take the kids out of school, they don't have to come pay for parking. So the parents have been amazed that this is something they can do, and they wondered why it took us so long to do this.
So I'm here at the Enhancing Patient Satisfaction poster, and I'm joined with 3 lovely ladies. Jordan, tell me a little bit about your poster.
So we wanted to increase our patient experience while they're there in the hospital, and it wasn't just the patients to focus on, but their families as well. So what we did was we implemented a few small changes to improve our patient experience and their families' experience while they were on our orthopedic floors. We implemented a card that gave a list of our hospitality services. We gave them a unit tour, and then implemented key phrases for our nurses to say to the patient when they're greeting them and when they're saying goodbye for their shift, just to make them feel like we really appreciated them being here at Mayo.
That's really amazing. So Stephanie, what do you think's been the best comment you've received so far from the patients regarding this?
With our project, we provided surveys, and patients were given the opportunity to leave comments and give feedback. And I honestly couldn't pick out one specific comment or feedback. It was overwhelmingly positive. It was so great to see those comments about specific nurses, specific experiences. It just really validated all of our hard work.
That's really cool. So Chelsea, what do you think's been the most fun so far about Poster Fair?
The most fun, probably when we got our poster back for the first time from the media support specialist. It was so incredible to see all of our hard work finally out on display, and now we get to share that with everyone else at the poster fair, all the nurses at Mayo. It's awesome.
I'm here at the Power of Education poster, and I'm joined with Cindy and Tori. Cindy, tell me about your poster.
Our poster is about a preoperative education class that we offer our prostatectomy patients and their caregivers. And it's a class that really provides information on how to prepare for surgery. And the main part is learning about the catheter itself and how to manage the catheter once they're discharged from the hospital.
Wow, that's really great. So what do you think has been the best feedback you've heard so far from the patients regarding this?
So I think the biggest feedback we've gotten from patients and their caregivers is the reduced anxiety that they experience after surgery compared to before with that extra education.
Dawn, can you tell us about your poster?
Well, our poster shares how the adult educators combined with the pediatric educators to redesign the HEMONC BMT curriculum, which prepares nurses to give chemotherapy. From a curriculum that was predominantly lecture-based to one that incorporates active learning strategies, pre-work, online modules, in-classroom case scenarios. And in doing so, we were able to decrease classroom time by 55% and maintain learner competence. And 95.5% of our learners actually reported that they felt well engaged in the classroom.
I'm joined here with the co-chairs of Mayo Nursing Council that hosted this wonderful event today. Janelle, can you tell me about the event?
It's 38 posters that are highlighting nurses' work, their innovation, their energy, and their love for nursing and their passion for their patient care.
Jen, what do you think has been the best part so far for you about Poster Fair?
I think one of the most exciting things to see is the energy that nursing has to bring every day. It's the same energy we have with our patients every day, with our families, with everyone we encounter, with our colleagues and in the work we do. However, when you bring it here today, you can see it on the posters, you see it in the collaboration, and it's just really a fun environment that we want to bring back to the bedside as well.
So Jody, if for somebody that's never been to Poster Fair before, what would be one thing you would get them excited about to come?
So our goal is that you come, become engaged, take what you've learned here today, take it back to your practice committee and incorporate it in your practice, into best patient experiences, and into good patient care for the future.
Well, this is an amazing event, guys. Thank you so much for having us, and great work.
Thank you.